I think there's a specific line to be drawn between undergrad and med school, because once you get into med school, I think that's the toughest part of this whole process for me, was getting in. I think once you get in, you're kind of you're in the inn and you're on their side, and your advisors and teachers then kind of push you through to become a doc once you're in med school. I think the advice that I would give is that the first group of people, the pre-med or the high school student who's thinking about doing medicine, and my advice would be don't listen to distractors. And it can't be done. People apply and get rejected from schools for years and years. I applied to, I think, 13 schools my first year, and I got into one. I got into Creighton, so that's where I went. Didn't have to take a year off or anything like that, like a lot of people have to do, because so much is focused on the MCAT and these other things, and not everybody are great test takers for whatever reason, and don't get into Harvard and Johns Hopkins and WashU and all these things. So I would say continue to be persistent. I had my backup plan was like, coaching basketball and teaching biology. It was a terrible plan. It wasn't going to work at all, But so I got into Creighton, and the rest is history. But I would say you can do it. Study hard, work hard. If you're looking for a new job, or if you're considering coming to the medical group or Missouri Baptist or whatever, I would, think about the flexibility that we have here, the call structure, the electronic medical record, the great hospital, the great nursing staff, and basically you can realize that these things are possible. If you're unhappy in your job, I'm not. I love my job. It's great. It's terrific, and I'm new at this too. So I think as I gain even more experience, it'll become even better. So I would encourage you to consider us.